So briefly, the COVID testing situation has been poorly handled. We initially had something called a serological test, which is a test that involves PCR, which is something called polymer chain reaction, which is a lab test that can sometimes take 48 to 72 hours to come back. And given the fact that we have to test so many people, using a test in that regard has been cumbersome at best. People have trouble scheduling the tests, people have trouble getting results in a timely fashion. And one of the problems is that once you have the test, the results, if they are delayed, become less and less important because you could have been exposed in the time that you're waiting to hear your test result. And so at that point, your test may no longer be valid. The other problem with that is that it requires a nasal swab, which to anybody that's had that test is fairly uncomfortable. And the nasal swab has a significant false negative and false positive problem where you may or may not get the RNA of the virus on the swab. And so that was our initial offering for testing. Subsequently, they've developed antibody tests. Antibody tests are less effective because they require a significant time delay from exposure of the virus to an antibody response. So you can imagine that there may be a time window where you are infected with the virus, but you don't have an antibody response, and therefore you're going to get a false negative test. These antibody tests are getting better, and they're becoming more accurate, but they are not as effective as, detecting viral proteins or viral RNA directly. The third type of test that is promising are antigen tests, which can be manufactured to be point-of-care tests. There are proteins on the surface of the virus that can be detected, and you can set up testing that is less invasive than the swab in the back of your throat. Sometimes it requires just saliva, and these tests can be utilized in a point-of-care fashion, meaning that if the test is administered, you can have results within 5 minutes. Those tests can be cheap to make, easy to distribute, and can be manufactured in large quantities, and are probably the better way to go for population-based testing. So this has taken us, months to sort of sort through and try to figure out how to administer the right test. Our idea is to make a pod or a kiosk that is safe for the provider to administer a test. The idea being that there's a small area where a patient can enter and be separated and sealed off from the provider by a plexiglass barrier. We have gloves and ways to administer the test to the patient that are safe. They don't require any personal protective equipment. You don't have to run through masks and gowns and gloves and splash shields as if you were testing in a hospital. And these little pods that we're developing are also going to be a way to decontaminate the surfaces of the patient, including clothes and hair and skin, with a specifically targeted ultraviolet light. These lights will be on the patient side of the pod and will be turned on during the testing phase. So not only are you getting tested for the virus, but you're also getting your surfaces decontaminated by the light. This serves to clean the air in the area of the patient. This serves to decontaminate the skin surfaces, and it also serves to clean the pod between patients so that there's no chance of contacting the virus from a patient who was positive, who was just tested right before you. It's also going to be done in an isolated area outside the facility So in a parking lot, for example, and these pods are mobile, easily moved, and we'll be able to quickly process and collect data on a number of patients prior to entering any sort of work facility. One of the reasons that we're building these sort of containment areas is that we want to be able to advance with testing advancements. So, for example, it took us 6 months to figure out that antigen tests are probably the right way to go. But our pods are sort of test agnostic, meaning that we want to provide an environment that's safe for the patients, safe for the providers, won't be a way for the virus to spread. And then as the tests become better and better, we'll be able to implement different testing protocols into our pods. So it's sort of a way to accurately as possible determine your COVID status. It's a way to screen people prior to entering a facility, whether it's your workplace or a hospital or a nursing care facility or a meatpacking plant or whatever. We've been able to put together a testing algorithm that will give you your COVID status to the best of our technology prior to entering an area where you may be at risk of contamination.